Well, thanks very much for that kind introduction. First of all, the most depressing day of the year, and they've locked the doors so nobody can get out. So it sounds as if it's going to be an enjoyable presentation. I'd like to talk a little bit about volunteering and promoting health and safety, but also just to give you a wee bit of background on how I got to where I am just now. So that's basically the timeline of various things that I've been involved in. I started, believe it or not, I look too young, but I started in 1974 when the Health and Safety at Work Act first came out. And I spent 26 years with a manufacturing company in Coatbridge, which is a small village outside Glasgow, where MSA, a global American manufacturer, had 28 manufacturing plants. One in Scotland employed about 650 people. At that time, there was a major mining industry. MSA stood for Mine Safety Appliances. There were 250,000 miners underground until there was a wee fallout between Arthur Scargill and Maggie Thatcher, and that changed it quite a bit. But I spent a very good 26 years doing 13 jobs, and I ended up on the senior management team. But part of that time was I had to do a tour of foreign duty, and I'd done that down in Birmingham for 5 years, from 1980 to 1985. And that's when I first got involved with safety groups. Subsequently, when I came back up, I ended up being involved with the Grampian Safety Group up in Aberdeen, and latterly in my career when I ended up working for an end user, a major end user, the fire service. In 2003, I was brought in as a civilian to manage the effective protection for about 3,200 firefighters in the west of Scotland. So I was poacher turned gamekeeper. And I got the opportunity to have an input into the evolution of protective equipment for firefighters, where PPE is not the last resort, it's the only resort. And we have to make sure that people get into situations that they can get out of safely. So it was a very good experience for me. Retired from the fire service, early retirement, by the way, in 2013, when they merged Strathclyde Fire and Rescue into the one national Scottish Fire Service. I'm still involved. I'm the secretary of the Fire Service Heritage Trust, and I became chair of Safety Groups UK, which is a charity. We facilitate, and we're the overarching body for about 72 local safety groups up and down the country. The ones in Scotland are known as under the umbrella of the Scottish Chamber of Safety, and we're very fortunate we have a few people from SCOSS here today. But safety groups on a national level, we have worked for very, very many years in partnership with HSE to try and cascade out key information and raise awareness, particularly more recently with SMEs. And we're supported by ROSPA. They provide all the secretariat and the back office administration and do our website. Now, we've heard a lot today about partnership working, and I'm very pleased to say that Scotland's been in the forefront of partnership working, particularly with regard to things like health risks at work. Back in 2009, 4 bodies in Scotland got together to try and simplify the occupational health message. We were very fortunate that we had the Scottish Centres for Healthy Working Lives, with ROSPA, with the Health and Safety Executive, and with SCOSS, the Scottish Chamber of Safety, and myself and Norman Stevenson and other people, Karen McDonnell, were on a working group that tried to take out the highfalutin words and all the jargon that was there to deal with occupational health, to do a literature search and distill down to the basic elements that were not time limited, that we could use for years to come. And we broke the health risks down into 5 basic ingredients, because when you're dealing with something as massive as occupational health, it is the elephant in the room. You have to eat an elephant a chunk at a time. So we try to break it down into risk to skin, risk to breathing, risk to muscles, bones and joints, noise and vibration, and well-being. And that pretty much covers all the major elements of health. And that was basically targeting long latency disease. We were trying to have a vehicle that would engage with people and then be used to signpost them to where they could get additional help and information. We also were trying to make it personal, so people would take a personal interest in their own health. So to use that well-worn but very relevant old adage, good health and safety is good business. Over my career, I've found that you have to engage with all the people involved in making decisions with whatever it is you're trying to sell. And we're trying to sell the message that good health and safety is good business. So we need to not only engage with the operational personnel, but we have to engage with the financial personnel, the health and safety personnel, and MD who can influence decisions. We need to get the CEOs on board, and we need to get them passionate and driven about looking after the worker welfare, but also the fact that it can add to their bottom line. Now, I've got a symbol up there of £1. When I give this talk down south, I talk about every pound being a prisoner. Here, as you know, in Scotland, every penny is a prisoner. So we are very astute when it comes to getting best value and how to lever the benefit. But equally, we need to use tools available to us in terms of how to communicate the message. And in quite simple terms, if somebody's trying to send a message out, you've got a sender and you've got a receiver, and you've got a message going down a channel, but as it's going down towards that receiver, there's a lot of interference. And that's very true in the UK health and safety community and in Scotland as well. Particularly with SMEs, there's a lot of clutter, there's a lot of interference between messages going out and them getting the message. So how can you improve your chance of getting through? You keep the message simple, you repeat it, and more importantly, you amplify it. And the way in which we can amplify it in this room is coming together and joining the dots up and getting those key messages sent down in as high a amplitude as we can get to give it the best chance of getting through. Any competitiveness or any distractions, leave outside the room. That's why the doors are locked. Yeah? So we focus on the key messages and we repeat them because this is long term. If we want to mitigate against long latency disease, we've got to play the long game. And that means we have to look at refreshing the message and using different ways of getting that consistent message out. And we want to lever the benefit between us all. Now, we need to engage. So, again, if we take some models from industries who have to sell a message, they talk about getting attention, getting interest, getting desire, and getting action. And these simple tools are things that we have to utilize to help maximize success. Partnerships continue to target particular sectors. So in terms of long latency disease, we've heard the figures, and the figures are enormous. But we have to start reducing these figures. So if you take 13,000 people who are dying every year because of long latency disease, they've not been getting the headlines because these people, unfortunately, they pass away in hospital or they pass away at home. They've left their place of work and they don't get the headlines that perhaps somebody who unfortunately dies because of an immediate cause and effect type accident. So to be effective, we not only need very strong messages delivered very clearly and consistently, we need to target them. So in terms of long latency disease, 13,000 people dying. The vast majority, probably 2/3 or more, are dying because of the inhalation of dangerous and hazardous particles, particularly dust. And then the industries that are most susceptible to these are industries like construction. We've not only got the longer, well-known hazards of asbestos and asbestosis, but we've got silica. And silicosis is reckoned to account for about 500 deaths a year. But these are preventable deaths by taking simple and effective control measures. So by applying the hierarchy of risk, even getting down to the deployment of on-tool extraction and local exhaust ventilation engineering, we have a chance of not relying upon the final resort in that case, which is respiratory protection, which people use ineffectively and really don't get any value out. So let's try and not expose people to dust. If it comes that they need to have RPE as a second backup, make sure it's the right RPE, properly selected, and it fits them. And it's important that they understand that the dust that is going to give them disease is a dust they can't normally see. So we need to have simple and effective ways of communicating that and getting that message across. Now, I mentioned innovation and I mentioned working in partnership. Now, over the time I've been involved in a lot of industry. I've been at the coalface, I've been down the pit, I've been in toppy coke ovens and down sewers, all the very nice places people want to go. But we have to refresh the idea, and we in safety groups have started to engage with organisations. We've got sponsors, we've got partners, and we've got supporters. From the sponsoring point of view, we've been engaging some small revenue from a number of sponsors to help us operate. But one who came on in the last couple of years were 3M. And 3M are a global known brand. They're very protective about their brand. But they wanted to partner with safety groups to help cascade out the information about health risks at work. And they come up with a very novel idea. Now, this is it. It's called the Safe Tea Break. And it's basically a box, and in that box, there's 2 packets of Jammy Dodgers, there's tea bags, and there's a sort of a toolbox guide that takes you through the basic elements of health risks. And the idea is to sit down with the workforce over a cup of tea and chew the fat and talk about the issue. Communication is essential. So that's an interesting, as I say, a refreshing approach to what we can do with health risks at work. That supports the multi-language DVD that we give out free of charge. It's on the Health Risks at Work website. It's an 8-minute DVD. It's in English, Polish, Chinese, Urdu, and Punjabi. I got it in the neck the other week because we haven't got a Welsh version yet. I don't know what will happen about the Glaswegian version. I think we'll get to that eventually. But that's free of charge. All of this information is free to you. So I would suggest strongly that you look into health risks at work. And within the 5 elements, we've got new campaigns on It's in Your Hands for Skin. We're doing a big push shortly on Clean Air Take Care, which is really going to highlight the dangers of dust and other inhalable hazards. Now, we want to celebrate success as well, and we have an annual awards ceremony, which is hosted. It'll be next Monday down at the House of Lords, believe it or not. And it's really quite humbling for a wee guy from Coatbridge to go down and chair a meeting at the House of Lords, particularly when I've got Lord Broome on one side and probably Lord Mackenzie on another side. But what we do there is we celebrate the activities of the 70 or so safety groups in the UK. And this time, we've got about 10 gold award winners, we've got bronze award winners. But the last one that was given out in January 2015 was for the 2014 award winners. And the overall award winner was the Isle of Wight Health and Safety Group. And they focused on raising awareness of health risks on that particular island. And they've done it in a very good and close way and repeated the message, and it's taken off down there, I'm very pleased to say. We talk about health risks at work a lot, and I've given a number of presentations at seminars, and a number of them have been at this sort of time of day, just after lunch or just before people leave, and I'm looking to see if anybody's sleeping yet. But I would look about and I might see some eyes starting to glaze over. And over the last year or so, I've been introducing a new element to try and waken people up. And pardon me if you've heard these sort of things before, but one of the elements that needs, I think, to get emphasised more is the consequences of not doing anything. If you're involved in an area where you know about the risk and you decide not to take any action, then, as my mother would say, hell mend you. You knew. What I'm more interested in is people who don't know and don't know the consequences. Now, to my way of thinking, there are 3 basic consequences. One, the likelihood is that you'll get a chronic disease, and a chronic disease has no cure. It will impact upon you and your family for as long as you live, because you'll have to attend hospital, you'll have to take medication, you might be limited in where you can go because of insurance and so on. Not a good thing to get if you can avoid it. The second thing is that you're likely to have a ruined retirement. You put money away all your life, you maybe, you and your partner have paid for your house, your kids have went through university, you've got some free cash, you can then maybe do the things you want to do and travel and so on. But you're the person looking out the window at other people doing it, because you might have the money, but you haven't got the health. There's no pockets and shrouds. And the final thing is that, and it came to me a few years ago, back in the day, as I say, when there was a Labour government, one of my pals was an agent for the Labour Party. And I used to get taken along to socials and miners' clubs and working men clubs. And the local MP, or on one occasion, John Reid, who was the Secretary of State for Northern Ireland, came along. And they have a social, and they sit down like this at tables, and they have something to eat, maybe pie and beans or fish and chips. But somewhere along the line, there's usually somebody with an accordion or a fiddle, and they'll strike up a tune. And people will go up and have a bit of social dancing. But then, when you look a bit more closely at the tables, a table of 10 might only have 2 men on it. A table of 7 might only have 1. Because in central Scotland, because of the heavy industry and the legacy of long latency disease, a lot of the men died young. So you have women up dancing with women. I don't want to see that in the future. We have to change things. We have to change attitudes. We have to change culture. And I think we have an opportunity to do it. Now, I'm not Private Fraser out of Dad's army. I'm not standing here saying, we're doomed, we're all doomed. We can do something about it. We can change it, but we have to start on that journey. And one of the things that we need to do is we need new approaches, we need new initiatives, and we do need to engage with young people. Now, although Safety Groups is a very small charity, I think we punch very much above our weight. And we have a lot of really good and enthusiastic people as part of the organisation. A lot of them are ex-HSE, people who've retired and have joined us to help us. So Safety Groups in the culture in the organisation, we welcome people who are passionate and want to make a difference. If it's in your DNA when you've been in work, why should it stop? So I would make a plea for anybody here who wants to get involved with Safety Groups, particularly in Scotland. Please let us know. We've got various people here. We've got Norman Stevenson, who's the chair of SCOS, and we've got Jane Murdoch, who's the vice chair of SCOS here, and myself. Any of us will be happy to help you. But we have a new pilot project underway called LOCR, Learning Occupational Health by Experience and Risk. Ideally, as an organisation, we would have liked to take it to education, to schools, and get health and safety on the schools agenda. However, we're now targeting apprentices. So that's the next generation. So in closing, I'm very positive about where we're going with health and safety. I'm very proud of the template that's been set up in Scotland. Scotland have been very much at the forefront of leading change throughout the UK, and long may it continue. Thank you very much.